if somebody has received therapy for their CLL and their disease come back, what happens at that point in time? And there's many things that your doctor has to take into consideration. You should be retested for your chromosomal abnormalities. So if you did not start off, if you had no abnormalities, or you might have started off as having a deletion 13q, which is a favorable thing, but then you've gotten some form of therapy and you relapse again, it's important to retest that at that time. And the reason being is because it is not uncommon for patients when they relapse time and time again, eventually, that you can acquire other chromosomal abnormalities, so other adverse features that you might not have presented with initially, and the doctor will, again, may choose therapies that might be more beneficial for you depending upon that. And it also tells the doctor a little bit something about the kinetics of your disease. So if you acquire a 17p or a p53 abnormality at that time, then for sure the doctor is going to be choosing something that's a novel agent. If you had already gotten ibrutinib, then they're likely going to go to venetoclax or a venetoclax combination. So it really does depend. So it's important for you to have retesting done at the time that you need treatment again. And so that's, I think, a very important part of this. Now, how long then will that next therapy last? And partly that does depend on a lot of different things. So one is your first line therapy, how long did that work for? For some individuals, if that worked for years, then the likelihood is a subsequent line of therapy also may work for years. However, what if the kinetics of your disease have changed and now you've acquired some of these aggressive features? That's different. So so in part, how long will the next line of therapy work does a little bit depend on how your disease might have changed and what was your response to whatever frontline therapy you might have gotten. And so those conversations we always have to consider when a patient has relapsed. We're considering both as your physician and trying to figure out what's the best line of therapy depending upon your disease at the present time and what you responded to initially and for how long. And that helps the selection process as well. Of course, in addition, you might be older and have more medical problems, and we have to take that into consideration too. You might be on much different medications than when you started 5-10 years ago. And so those are into consideration when we talk about different therapies and options for therapies as well. So all of that will be as part of the discussion when you're then talking about your second line treatment or your third line treatment. Similarly, when we talk about subsequent therapies for folks with CLL when they re-present with disease, we're thinking about how fit are you now, what are your comorbidities. These things affect your performance status, and some of that may play a role into the type of therapy that your physician may choose for you at that point, depending upon what other medicines you're on, what are you able to take? Are there any drug-drug interactions between these medications? And so that will all play a role as well, in addition to what your disease is doing or how your the features of your disease may have changed as well. And so your doctor has to take all this into consideration when choosing a future treatment option.